Hey, there. Your health is your most valuable asset, and your pancreas plays a key role in keeping it in check, even if you don't always think about it. Digestive issues, high blood sugar, or constant fatigue might be signs that your pancreas needs some attention. In this video, we'll share simple dietary changes, natural remedies, and helpful tips to keep your pancreas healthy. Stick around, what you learn today could make a big difference in how you feel. And if you haven't subscribed yet, make sure to hit that subscribe button and the bell so you don't miss out on important health tips. Can a person live without a pancreas? After all, it's a small organ that seems to play a minor role in the digestive process. The answer is yes, but in that case, the body would need regular insulin injections and enzyme supplements to help digest food. In reality, the pancreas plays an invaluable role, and that's what we're going to talk about today. We'll also dive into the structure and functions of the pancreas, and give recommendations on which foods are beneficial and which ones you should avoid, or even completely remove from your fridge. Plus, we'll talk about the vital role of herbal therapy in preventing and treating pancreatic issues. But before we get to the good stuff, I want to mention that 70% of our viewers watch the channel without subscribing. If you're watching and haven't subscribed yet, please support the team by hitting that subscribe button and ringing the bell. Make sure that button says you're subscribed. Thanks in advance, and enjoy the video. So, what's the pancreas for? While it doesn't play a direct role in the digestion process, it's absolutely essential by producing up to 2.5 liters of pancreatic juice a day. This juice is a mix of enzymes and substances that help break down proteins, carbs, and fats. The main enzymes include lipase, which breaks down fats, protease, which breaks down proteins, and amylase, which processes carbs. At the same time, this little fighter also plays a dual role as both an endocrine and exocrine gland, producing insulin and glucagon. The pancreas decides which hormone the body needs at the moment. If blood sugar is low, it releases glucagon, and if it's high, insulin steps in. So, even though the pancreas is made up of two different tissue types, it works together perfectly as one cohesive unit. Pancreatic diseases. The pancreas is one of the first organs in the digestive system to suffer from an unbalanced diet and bad habits. Even though it's pretty resilient, it can't handle neglect. The most common diseases affecting the pancreas are pancreatitis, type 1 diabetes, and cancer. Pancreatitis. Pancreatitis is the inflammation of the pancreas, and it comes with some pretty intense symptoms like sharp, radiating pain in the upper abdomen. It happens when the enzymes produced by the pancreas don't get where they need to go and start digesting the pancreas itself. During this, the person experiences severe pain as the cells get damaged and inflamed, and scar tissue forms, which later disrupts the pancreas's normal function. Over time, pancreatitis becomes chronic. Along with the pain, symptoms include nausea, diarrhea, high fever, and greasy stools with a foul smell. Pancreatitis is dangerous because it can lead to complications like kidney failure, breathing problems, infections, pseudocysts, nutrient deficiencies, diabetes, and even pancreatic cancer. Pancreatic cancer is a malignant tumor that most often leads to a fatal outcome. The pancreas can be divided into three parts: the head, body, and tail. Statistically, most cases occur in the head of the pancreas, with fewer affecting the tail. Genetics only account for about 10% of cases, while the rest are caused by harmful external factors. For example, pancreatic cancer can be triggered by alcohol abuse, smoking, as well as diseases like diabetes, obesity, and others. Type 1 diabetes is characterized by high blood glucose levels and occurs when the pancreas doesn't produce enough insulin. Doctors call this a dysfunction of the body's internal secretion. However, scientists have found that in most cases, the disease is directly linked to genetic predisposition. Factors that trigger the development of type 1 diabetes include a lack of breastfeeding in infancy, viral infections like rubella, hepatitis, chickenpox, and others, as well as tumors, alcohol, certain strong medications, and other chemical substances. What foods should be excluded from the diet with pancreatitis? The development of pancreatitis isn't age-dependent, but it is directly related to lifestyle and the food we eat every day. In 2013, a study showed that a group of people with pancreatitis who consumed any kind of food, including fatty, spicy, smoked, or acidic foods, suffered from more frequent pain attacks. Later, all of them were diagnosed with chronic pancreatitis. So, take note, doctors strongly recommend that people with pancreatitis eliminate foods high in fat, as well as those that irritate the stomach lining or take a long time to digest, causing gas and bloating. Fruits and vegetables should not be eaten raw, they need to be baked, boiled, or steamed. These cooking methods also apply to other foods. Therefore, foods to exclude from the diet include fruits and vegetables like garlic, mushrooms, spinach, cabbage, beans, peas, onions, citrus fruits, and nuts. All carbonated drinks, coffee, and alcohol of any kind. Pastries, cakes, and pies with heavy cream, fresh bread, rich buns. Ice cream and chocolate. Everyday foods like fatty meat, sausages, fish, egg yolks, fast food, mayonnaise, vegetable and butter oils. All canned, smoked, marinated, and spicy foods. In case of an attack, it is recommended to fast and apply something cold to the affected area. Diet for preventing pancreatitis. Proper nutrition plays a crucial role in the digestion process, and the goal of this diet is to ease the workload on the digestive organs and reduce the production of enzymes. Healthy eating for digestive disorders includes the following foods: vegetables, pumpkin, cucumber, zucchini, eggplant, potatoes, carrots, bell peppers. Fruits, bananas, watermelon, apples, pears. Drinks, compotes, light green or black tea, coffee with milk, and still water. Meat, lean meats, low-fat sausages, lean meat, and fish. Everyday foods. Low-fat dairy products, egg whites, crackers, stale bread, oatmeal, rice, spaghetti, desserts like marmalade and honey. So, a diet for pancreatitis is a crucial part of treatment, improving the quality of life. Dietitians recommend eating 5 times a day, with meals that are chopped or blended to make them easier to digest and more nutritious. As inflammation decreases, you should gradually return to more regular foods, but introduce them carefully. When eating fatty foods, it's a good idea to take enzymes to make up for the body's lack of its own enzymes. Folk remedies for cleansing the pancreas. As we've mentioned, issues like digestive problems, high blood sugar, and constant fatigue can signal disruptions in the pancreas. While folk remedies aren't a cure-all, they can definitely help relieve symptoms and speed up recovery. Oatmeal infusion. Oats are a staple in any diet menu, especially for people with carbohydrate metabolism issues. For a daily diet, you can make a concentrated oat infusion. Simply take half a kilogram of oats, pour boiling water over it, let it steep for an hour, then strain it. Drink 1 cup every day. During acute flare-ups, plain oatmeal cooked in water without salt, oil, or sugar is also beneficial. Herbal blend. To stimulate the pancreas, a blend of equal parts coriander, dill, elecampane, cudweed, and mint can be used. Steep 2 tablespoons of the blend in 2 cups of boiling water for an hour, then take it 3 times a day. Herbal infusion. It's best to prepare a fresh herbal infusion every day. Metasweet herb, labasnik, is particularly effective for relieving pain from chronic gastritis. It's typically taken as a tea 3 times a day. To make it, simply pour boiling water over a pharmacy tea bag with the herb, and let it steep for a few minutes before drinking. Potato juice for pancreas relief. Folk healers recommend drinking a glass of fresh potato juice to help with pancreatic function. You'll need 2 clean, unpeeled potatoes. Grate them with the skin on, then squeeze out the juice. Drink half a glass twice a day for 2 weeks. Compress with buttermilk. Fermented dairy products like buttermilk are commonly used to restore gut flora, but they can also be applied externally. For pain relief, a compress soaked in buttermilk works well. Apply the soaked cloth to the left side under the ribs, secure it with plastic wrap, and cover with a warm scarf. Leave it on overnight. Japanese Sephora decoction. This plant is used to relieve symptoms of pancreatitis. The beneficial compounds in it, such as rutin, phytohormones, essential oils, and flavonoids, help normalize pancreatic function. It's best to prepare the decoction in a thermos. Pour hot water over a bunch of the herb and let it steep for several hours. Drink the decoction 3 times a day before meals. The treatment course lasts for 2 weeks. Garlic, parsley, and lemon mixture. To help restore pancreatic function, a mixture of crushed garlic cloves, parsley, and several peeled lemons can be used. After preparing the mixture, store it in the fridge. Then, chop and mix with equal parts of blueberry, lingonberry, and strawberry leaves, bean pods, and corn silk. Pour boiling water over the mixture and let it steep for a few hours. The treatment lasts for 3 months, during which you should eat 1 teaspoon of the mixture daily. These are the tips we've gathered for you today. However, it's important to remember that before using herbal infusions, people under medical supervision should consult with their doctor. In any case, herbal therapy should be combined with prescribed medications. We're looking forward to hearing your own recipes for restoring pancreatic health. Stay healthy.